This is Average Joe PT, and we're here today. We're going to talk a little bit about back pain. Stay tuned. Now, Scully and I, we've been doing this for quite a while now, haven't we, Scully?
We've been doing this for a long
That's
time.
Right. And, we've talked about the back a few times. You can actually look at my channel list a little bit. I'll even leave a little link up here on some other videos about back pain. But specifically today, I want to talk about the pain that everybody gets when they do too much work over and over again, also known as repetitive injury. Or weekend warrior syndrome is also that is known. And so a lot of people think when they start to get a little bit of maybe sciatica or back pain or something that's off to the side here, and when you come up and zoom in close here, you can actually see, so this red thing is representative of the disc, and you have the upper and lower part of the bone, which is the vertebrae. And then when we turn around and see on the back side, real skinny people, they can actually see this spot here, these little bones here in the front, called the spinous processes. But off to the side here, these two bones meet up with one another, and they have a little kind of looking little spot here. This is called your facet joint. And a lot of times, that's where majority of your pain's coming from. That's radiating and then going into maybe some back spasms on top of it. This facet problem happens to a lot of people as we age. The two spots I'm talking about, they kind of glide on one another when we bend forwards, and when we rotate, they rotate to those two joints. And on those surfaces of those two joints, here and here, it's got cartilage on it, and over time that wears. Now that joint itself is kind of inside of a capsule. So when we look at this specifically right here, there's two spots right here, those actually have synovial fluid, not blood flow, that's nourishing that. And so when it comes to that type of nourishment, you want gentle, continuous movement. The static movements or the quick load movements really flare this thing up. It is also known in the name game of PT as facet syndrome. So that's usually what's irritating people. And some treatment ideas are real simple. You want to rest it, you want to ice it, and stay away from that repetitive movement, whether that's repetitive sitting too much, or if it was that bending and twisting, shoveling, or whatever you were doing, during the summertime hours. So that's really what's causing a lot of the pain. Isn't that right, Scully?
You better believe it. That's causing all the problems.
That's 99% of the time. It's exactly what it is. It's not coming from the disc. So think about that. Stay tuned. Now, if you have any questions at all, leave a comment down below. Positive, negative, whatever. And if you have any other ailments that's going on, treatment techniques that you can do in your own home, I got a ton of it on my channel. So you can go ahead and just flip through the different categories: ankle, back, knee, shoulder, hip, or just pose Scully and myself a question and we'll get back to you. Until next time, we want you to look up and keep smiling.